Hello, and thank you for watching this brief video. My name is Dr. Robert Shortell, and I've been in practice since 1997. I hope you enjoy this brief informational video I put together to describe chiropractic care. So let's start by discussing the goals of this office. My goal in this office is to help you eliminate your pain and improve your health naturally. As a chiropractic physician, I assist people in improving the 4 pillars of health: physical, neurological, mental, and chemical wellness. Physically, we assess and improve posture, strength, flexibility, and balance. Neurologically, our goal is to improve the flow of nerve information from the brain, through the spinal cord, through the nerves to every cell of the body through the correction of subluxations. Mentally, we evaluate to determine the 3 states of brain dysregulation that people struggle with that can increase the symptoms of anxiety, ADD, and depression. This is improved through specific treatment and exercises tailored to your unique situation. Chemically, we assist a person in proper supplementation and a targeted eating plan specific for each person. Physically, the main thing I work with is the spine. I also help people with extremity problems such as shoulder, elbow, wrist, hip, knee, and feet problems as well. The spine is broken down into 3 main regions. The neck, in yellow, is composed of 7 independent bones. The mid-back, in orange, is composed of 12 independent bones with a pair of ribs attached to each. The lower back is in green and is composed of 5 bones that is attached to your tailbone, which is colored red. The number 1 problem that causes damage to the spine and leads to degeneration and arthritis are what are called subluxations. On the left is a small healthy section of the spine. It is composed of 4 independent bones and 3 discs, which are between the bones and act as shock absorbers. The purpose of the spine is to protect your spinal cord and the nerves that travel between each of these vertebrae. On the right is a subluxation in the spine, which is the main problem chiropractors correct to promote proper health of the spine. Here you can see one of the bones does not line up correctly. This puts incorrect pressure on your disc, causing slipped discs, herniations, and degeneration. It also puts incorrect pressure on the bony parts in the back area called joints. This leads to arthritis. Lastly, if you put incorrect pressure on the nerves that exit between your bones, so when you get a subluxation, this will cause improper functioning of that nerve, and wherever that nerve goes won't function correctly. Research states that the weight of a dime results in 60% loss of the function of that nerve. How much does a dime weigh? Very little, so that's how fragile nerves are. Also, you see a number on the lower right showing 4%. This is the total percentage of nerves that deal with pain in your body. That is sharp pain, dull pain, throbbing pain, etc. So the majority of the time, when you have a subluxation that is putting pressure on a nerve, you don't even realize it. This is the same with conditions such as heart disease and cancer. These conditions start many years before you have any symptoms of a problem. So that is why it's so vital to get your spine checked by a chiropractor, even if you have no pain. So where do these nerves go? The nerves in your neck supply the red area. So when you have subluxations in your neck, problems in the upper half can refer into the head, causing headaches. Problems in the lower half of the neck can refer into the arms, hands, and upper back. Subluxations in your mid-back, which is the yellow area, can refer around the ribs to your chest and upper abdomen. Subluxations in your lower back, or the blue area, can refer into your groin, hip, and all the way down your legs to your feet. This is often called sciatica, which many people have heard of. The nerves in your spine also connect to your brain, which connects to every single cell of your body, including your organs. So when you have subluxations in your spine, it decreases nerve information to these organs, causing them to function incorrectly, and you have symptoms. Problems in the upper half of your neck radiate into your head and can cause headaches, dry eyes, ear infections, tinnitus, and migraines. Problems in the lower half of your neck can go to your throat, thyroid gland, and cause persistent dry cough, frequent throat clearing, and thyroid problems. Problems in your mid-back between your shoulder blades can go to your heart and lungs. This can aggravate heart problems, asthma, and bronchitis. Problems in the center portion of your back take care of your digestive system. This can cause improper functioning of the pancreas, stomach, liver, and gallbladder. Some common symptoms are altered blood sugar levels, heartburn, and elevated liver enzymes in your blood work. Problems in the lower third of your mid-back go to your adrenal glands, kidneys, small intestines, which can cause symptoms such as chronic fatigue, elevated blood pressure, and IBS. Nerves in the lower back innervate your large intestines, bladder, and sexual organs. Subluxations here can result in constipation, urinary urgency, painful or very emotional menstrual cycles, and also altered sexual performance. Subluxations disturb the normal connection of your body to your brain. So when you have injuries or subluxations in the body, it sends irritating information to the brain. This puts stress on the brain and can increase your symptoms of ADD, depression, and anxiety. So why are we looking at a picture of lobsters? Well, there's been research performed on lobsters to evaluate which lobsters are most dominant and healthy. Excuse me. What they found were two interesting observations, which were also found in human beings as well. The first was similar to the lobster on the right. The lobsters that were able to achieve the best posture and extension were the most dominant. So the lobsters that had the best posture were most healthy and most dominant. The second observation was that lobsters who had the best posture also had the highest levels of serotonin. Many people have heard of this chemical because it is one of the most important chemicals in our brain that helps to stabilize mental health and impact conditions such as depression and anxiety. So, the better your posture, the more serotonin you produce in your brain. This is why chiropractors are focused on reducing your subluxations and improving posture. Better posture has many beneficial effects. 1. It improves your brain function, reducing the symptoms of ADD, anxiety, and depression. 2. It reduces arthritis and degenerative changes in your spine. 3. Improves heart function. 4. Improves lung function. And lastly, improves the function of your digestive system. Lastly, we use targeted supplementation and your blood type to advise you on what dietary choices would reduce inflammation in your body and improve your health. So just another 2 minutes and then we're finished with this video. I appreciate your attention so far. So the main job of a chiropractor is to find these subluxations in your spine and gently bring them to proper alignment through what we call adjustments. The purpose of this adjustment is to improve the alignment and mobility of the bones of your spine. This takes stress and tension off your spinal cord and spinal nerves. This allows improved ability of your brain to send information through your spinal cord, through the nerves, to every cell of the body, resulting in improved physiology of the body. Just to remind you again, that just the weight of a dime impairs 60% of a nerve's functioning ability. Also, 4% of your nervous system deals with pain, so that when you have a subluxation that is negatively impacting your nerves, almost all the time you don't feel it. It doesn't hurt, it doesn't cause tingling, it just reduces function of the muscle, organ, or tissue it is supplying. Lastly, I just want to speak about the 3 phases of care people go through in our office. Most consult our practice because they're suffering with some type of ache or pain and want relief. So that's where we start with what's called initial care. Some see fast improvement with each visit, reaching the medium blue zone when they're feeling better. For others suffering from major trauma, they may find their symptoms seem to worsen at first and then show gradual improvement. Thankfully, most see steady improvement with each time and each visit building on the ones before it. So soon they are feeling better, reaching what we call decision time. We call it decision time because you'll have a decision to make. Will you build on the investment you've made and continue to strengthen the muscles and soft tissue, which are in the medium blue area, for lasting spinal change? Many people eventually choose to continue care into the third area, or what we call optimized part of care. This is the time when we see a patient between every 3 weeks to every 3 months just to maintain the changes, assisting the person in staying healthy. Sometimes, for many different reasons, a patient stops after the first phase of care, when their symptoms have reduced without properly strengthening and stabilizing their spine. This will often cause many people to have a relapse of their condition. If this happens, we'll welcome you back and begin again. Like before, when you're feeling better, you'll have a decision to make. Some prefer to start care, stop care, start care, stop care. It's your call. We're here to help. Whichever path you choose, our job is to provide you with the finest chiropractic care possible, and your job is to decide how much of it that you want. We made it to the end. I just wanted to thank you for choosing our office and assisting you in reducing your pain and improving your health naturally through chiropractic care. Have a terrific day.